Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology, right? Now, some of you already know what this is out there. Take a close look. Are you able to tell me? Right? It's a cross-section H&E from a vessel of sorts, right? And you know that because you can see a lumen, right? Can you remember or point out the tunica intima, media, and adventitia? So we're going to be talking about this and much more in this presentation on pulmonary hypertension pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code to get to the website that has all the updated material. Highly recommended. So pulmonary hypertension. Pulmonary hypertension. Now, what exists actually? What is this? Well, pulmonary hypertension refers to a form of high blood pressure that affects the pulmonary circuit, right? So in regards to this, the mean arterial pressure greater than 25 millimeters mercury is what's happening. And just for notification, normally it should be about 10 millimeters mercury. Now in this image, I want you to pay close attention to the thickening of the arterial wall and how small that lumen is, right? That's due to constantly being flexed and constricting in the setting of this hypertensive response. Pulmonary hypertension is characterized by atherosclerosis of the pulmonary trunk, smooth muscle hypertrophy of the pulmonary arteries, and intimal fibrosis. There may actually be plexiform lesions that may be seen with severe, long-standing pulmonary hypertension. Extreme pulmonary hypertension may lead to right ventricular hypertrophy, right? With eventual cor pulmonale characterized by exertional dyspnea or right side heart failure. Pulmonary hypertension is classified either as primary or secondary based on the main cause. Primary pulmonary hypertension is most prevalent among young female adults. The cause of primary pulmonary hypertension is unknown. However, some familial forms of pulmonary hypertension of the primary sort are attributed to inactivating mutations of BMPR2. Inactivating mutations of BMPR2, causing the proliferation of vascular smooth muscle. And here is an image showcasing various histopathologic changes and proceedings that lead to primary pulmonary hypertension. Secondary pulmonary hypertension is caused by underlying diseases or other known risk factors, right? Can you think of at least two? COPD, right? We talked about that. We also talked about pulmonary fibrosis. Those may do it. Obstructive sleep apnea could. Left-sided heart disease could as well, right? The most common causes of secondary pulmonary hypertension include hypoxemia and increased volume in the pulmonary circuit, like congenital heart disease. Secondary pulmonary hypertension may also arise with recurrent PEs, right? pulmonary embolisms. And with that, you've completed a very important presentation. Kudos to you. Keep up the good work. I'm proud of you. Everybody's rooting for you. I'm rooting for you. If there's anything I can do to help, or you have any questions, comments, or concerns, let me know. Till then, I'll see you later.